Candice Langford, pelvic and sexual health physiotherapist, and this is the Nurture Pod. We are talking pee, poo, pleasure, pain, periods, pregnancy, postpartum, peri, and postmenopause. All the P's, all supposedly taboo, yet essential to our holistic health and well-being. We are shining a light on each and every one of these, both confidently and comfortably. Let's get curious. Please note that today's episode contains information about drug use. For those sensitive viewers out there, please listen with care. Chemsex. We are putting two taboos together to talk about the use of psychoactive ingredients in an intimate experience. We are going to be chatting to an expert in the area that is doing her doctorate currently. So without further ado, let's talk about these two taboos and really trying to wholly and truly understand them so that we can best care for ourselves and for others when it comes to anything to do with pee, poo, pleasure, pain, periods, pregnancy, and so on it goes. All the P's. Thank you so much for being here. Let's chat to Aoife. But first, one of the most common questions that comes my way is how to have better and more satisfying sex. Although this is multifactorial, I so value the potential of erotic audio content to pique mind and body arousal. The audio app Guided by Glow aims to do just that. Their guided sexual meditation journeys gives you the space to slow down, relax, and connect you to your senses, your creativity, and of course, nurture your relationship to pleasure as you drop deeply inside the feeling body. Listen until the end of today's episode for a special gift from Guided by Glow. Aoife qualified as a psychiatric nurse in Ireland before relocating to London to carry out a master's. Aoife later commenced at Regents University studying psychotherapy and then subsequently completed a diploma in psychosexual and relationship therapy. Following a diploma in cognitive behavioural therapy, Aoife began a doctorate in psychotherapy at Dublin City University. Now in her second year of research, her interests are firmly in the area of chemsex with a particular focus on how clients with problematic use can be better supported. Aoife is an accredited psychosexual and relationship therapist working in private practice in Dublin, connecting with clients globally online. Thank you so much for being here, Aoife. I really appreciate your precious time.
Oh, thank you for having me. I'm delighted to be here and talk about a topic. It's funny, when I say firmly, it's because we've just had to think about our research topic for so long. And now I'm going, yeah, this is it. This is the one. So I'm grounded in it. I'm firmly in the chemsex scene.
There's no doubt. All right.
No doubt.
Okay, so Aoife, I've got one question for you. I really want people to feel comfortable and confident in this topic. So when it comes to chemsex, I first heard about it from you, but now I'm hearing it and seeing it pop up online more and more. So if you could please just help us to stay up to date, because I know that you are the person to ask about this, and then potentially give us ways or help us to understand ways in which people might experience or engage with something such as chemsex.
Yeah, and I think just on that note, I'm probably not the best person to talk about it because actually the best person would be David Stewart, who coined the term many years ago. And since he's coined the term, it's been on the rise, particularly, and which I can talk a little bit about. But ultimately, how we define chemsex, it's quite a long definition, but it's the use of psychoactive substances. So when we say psychoactive, we're particularly looking at 3 drugs that are used for chemsex. So that's methamphetamine, that's menfetamine, and it's also G. So you may also hear them called different terms. So meth or crystal meth or Tina is used for menfetamine, sorry. And then also that's why it's easier to have shorter names because they are very long, some of them. What a mouthful. And menfetadrone would be sometimes called meow meow. And GHB-GBL is also called G. So these are three particular drugs when we're talking about chemsex. And they're used in order to enhance sexual pleasure, elongate sexual pleasure, and they're particularly used. So this definition, or chemsex in itself, is used within men who have sex with men. So it's quite a cultural experience. And then alongside that, we talk about the episodes. So it's used over a duration of time. So when we talk about a duration of time, we're talking over the course of days or hours. So it predominantly happens over the course of a weekend. And we also talk about multiple partners. So multiple partners, around 43% of these men would say that they engage with 4 to 10 partners at a time. So it's happening with multiple people. So we don't describe chemsex as necessarily being alone. And we don't describe, and we can talk about this, as it being used amongst women. So it's particularly very culturally specific, with a certain type of drug.
Okay. I mean, just with what you said so far, I can really imagine the use of it being quite prevalent, or at least growing, because one of the most common questions that comes my way is how to have better sex. What can we do? How can we help ourselves? So, I mean, I know I mainly communicate, especially online, with heterosexual individuals. So I know this might be quite different in the community in which you engage with, but it seems to be such a common question, because so many people do struggle with low desire. Libido is what most people term it, but I really can imagine it being an alternative that people kind of turn to, especially when they feel that they're not supported in their desire to have better sex. So sure.
Yes.
And I didn't know that it was only in the community or the culture of men who have sex with men, which we know is not necessarily just in inverted commas gay men. Men who have sex with men may not identify as gay, which is something that maybe the listeners weren't quite aware of. But please keep sharing, because this is golden.
Yeah, and there's very little research that's been done. There's one particular research done by Alex Moyle and Kate Dymock, who looked at those people who identify as women and their use of drugs, so similar drugs like G, but these wouldn't be defined by these women as being chemsex. But also we have to look at the cultural component to this. And the reason we look at the cultural components is particularly around the history of gay men and their experiences around homophobia, around ostracization, around the AIDS crisis, and the impact that has for the gay community. And so these drugs, thinking about how they do heighten pleasure, but they also provide a sense of community as well, that you can maybe engage with people who are like-minded, who perhaps share the same kink or share the same fetish. And also it's about perhaps exploring aspects of your sexuality that perhaps were demonized or vilified before. So there's a sense of heightening pleasure in terms of those psychoactive drugs, but equally it can be about connecting with others and forming an intimacy, because that's what part of the euphoria does. It's not just the sexual pleasure, it's the intimate sense of connection with others. And that's been, I think, very substantial as to why people do get on it. So when we talk about the scene, we talk about it, and I'm not necessarily one to massively agree with this, but it's problematic. So people define themselves, or we define people as problematic or non-problematic. And the reason I have a slight issue with that is we're bracketing people into two groups. And really, do we like doing that anyway, by putting people into one or two boxes? I mean, 2 boxes isn't very many boxes. And also, is that or marginalizing an already marginalized group, like further doing damage. So, but when we do look at the chemsex scene, and we can talk a little bit about these drugs as well, which is part of the issue as to why they may be so problematic, which they are. A lot of them are very dangerous, particularly G, is that the problematic chemsex users are the minority. So they're about 33 to 35%. So that's quite small. So there are a lot of people who can enjoy drug use and the engagement with sex and enhancing sex. And there are people who, when we define it as being problematic, their life is spiraling out of control.
Yes.
So what often happens is that they are missing work, or they're coming separated from their families, or they're becoming addicted to these drugs, or maybe they're unable to get up in the morning, or they're unable to function. And that's when we start to see that the chemsex is spiraling out of control for them.
Yeah, and I can imagine so. What I'm thinking about as you're speaking, just with the stigmatization against drugs in general.
Yes.
One, what is it termed when individuals are using other methods, other drugs, other psychoactive ingredients such as THC in cannabis? And then two, I'm not supposed to be asking you more questions. This is a one question podcast, but I'm actually just quite curious here. What about the general kind of understanding or the stigmatization against drug use is that someone might be like, well, it's all problematic, Aoife. How can you say one is problematic and one is not? How does one classify that? I know that the two classifications is a problem, but does that make sense? What I'm asking?
Yeah, it does make sense, and I don't necessarily have a definitive answer. I suppose there's like that is a really like powerful question, because actually I think there's a really philosophical aspect that many of us could debate with many different lenses through this. And so if we think about alcohol, even, alcohol in a sense is a drug, but it depends. And I mean, obviously, I'm Irish, and so we have a very different culture to say when I was in London for 10 odd years. And so the relationship with alcohols may be very different in different cultures, or your just identification with it in itself. And we have to look at as well around the deaths that happen with drink driving, for example, or any way in which alcohol dependency is an impact on the liver. And so I suppose it is difficult to kind of create a really clear answer to this, because it's also very subjective, which is, I think, part of why I have an issue with the problematic and non-problematic, is because really we as practitioners are labeling people. We don't necessarily in that literature encourage people to think, well, how do you define it?
Yeah.
So what is it for you? And maybe those stats would change, and that could be quite interesting, which is part of my research will be about trying to understand people's experience, because the literature around chemsex is so heavy in a kind of epidemiological aspect. And when we talk about that, it's kind of public health. Yeah. So in other words, we're talking about the stats, and we're talking about the kind of crisis that chemsex, and there is a crisis aspect to it. But there's about 5 out of 120 pieces of research that I've read that are around the lived experience of people engaging with chemsex. So the other pieces are looking at the HIV diagnosis, the increase in STIs, the death rates, all very legitimate and very fair. But we also have to maybe just balance it a little bit more by talking about the lived experience for people.
Yeah, that makes absolute sense.
And so that's subjective.
Yeah, I think that maybe is what kind of triggered the way in which I asked you the question in the beginning, because I think that's maybe where the gap is what is actually happening. What are the experiences that people are having in this chemsex community, and how are they engaging and what's actually happening in their lives, as opposed to
Yeah.
looking at the pathology of all of it and just trying to give a
Yeah.
diagnosis or just assuming the risk outcomes. Okay,
Yeah.
amazing.
Yeah. And that's a good, way of talking about it, and maybe introducing a little bit into my work as a therapist. So when people come to me, they tend to fall within the problematic aspect, right? They don't tend to come to therapy because chemsex is going great. It's because something has happened. So the things that tend to come in are things like HIV diagnosis. So a sexual assault, which is common within the chemsex scene. Things like a trauma, an overdose, and also I would the big one, which is very common and for many people who are struggling with like a compulsive aspect. So whether that's sex, whether that's dependency like drugs or alcohol, is that somebody's had some form of intervention with them and said, I think there's a problem here and you need to get help. So that's what tends to come to my door. And what I see with those people who come to my door who've had a really problematic experience or are engaging with problematic chemsex use, and that sense of life is spiraling out of control, is that they tend to have had trauma from their childhood that's connected with their sexuality. So they've been ostracized by their family, kind of like excommunicated from their culture, that perhaps they've had experienced a lot of bullying growing up, whether they have a lot of doubts around their sexuality or kind of exploring their sexuality and had some negative effects around that. So what I do tend to see the problematic, the people who engage in problematic chemsex, and that's something that I think is really important that we do equally talk about, that there is therapy and that there is support out there.
Yeah. Right from that phase of early childhood trauma, you know,
Absolutely.
I mean that's why this is so important. It might be quite uncomfortable for people to hear others or professionals talking about drug use,
Mm.
and to know that, oh my word, Aoife's doing her doctorate on this.
Mm.
It might be uncomfortable for people to hear that and accept that, but this is how we
Yeah.
best support people, is by finding out,
Yeah.
exploring, digging deeper, really getting to the
Mm.
roots of every facet of this chemsex experience, so that we can best serve those that need help within the chemsex community, and also potentially prevent from someone from either engaging in chemsex from the starters, or prevent them from going from comfortable use to problematic use, as is the little box that we
Mhm.
tend to put them into.
Mm.
So
Mm.
yeah, sure, okay.
Absolutely. And I think if we don't talk about it, we're maintaining a shame.
It's still
We're
there.
maintaining a
It's still
stigma.
there. And it's still
Yeah.
there. It doesn't go away if we just
It's
hide
still
away from it,
there.
ignore it, and don't research and don't talk about it and
No.
don't bring it into this podcast. We have to bring things out into the light, so we can prevent childhood trauma, so we can prevent problematic drug use, as does the
Mhm.
title say. Okay, sure.
Mm.
Yeah, keep telling us
And I,
these gems.
yeah, I know, no, and and like I almost think that there's so much, there is so much space to talk about the pleasure, and this is one of the things when we kind of touched upon this podcast and talking about chemsex, is there's pleasure and there's pain, and there's a lot of the kind of discourse is around pain, but we have to understand why people are getting into it, engaging with it in regards to the pleasure too. And so we can't just almost categorize and label it as just one aspect, which is important in terms of harm reduction. And I would definitely like to just touch on that, but also is that pleasurable aspect of why people get into it in the first instance, that sense of feeling like they're in a community, or the sense of exploring their sexuality, or a sense of being accepted. But that can spiral And so understanding that in a multifaceted way as to where it originates from, why it's there, those childhood experiences, those young adult experiences, and how that impacts people into engaging in ways that aren't always cathartic, that aren't always helpful.
I love that you speaking about pleasure, and you didn't just say sexual or tactile, the typical sexual pleasure. You're talking about community, the pleasure of community, the pleasure of connection, the pleasure of intimacy. There's so many more facets to pleasure than one might initially think. I mean, let me not go too far into that, but I just love that you did acknowledge the different areas in which we can find pleasure, and how people might be drawn into this community, not just for sexual pleasure. It's community, it's the people, it's an individual needing a community because they potentially had this childhood trauma, or this lifelong sexual trauma, whatever it may be. So we need to understand that, we need to hold a space for these people.
And even that sense of people being, unable to be their authentic selves in their childhood, in their upbringing, in their experience. And a lot of the people that I tend to have seen haven't had accepting families. That's one of the main threads that I see, not accepting families in terms of their sexuality, in terms of coming out, that perhaps it wasn't safe to, or perhaps they did and they were ostracized. And so if we think about that sense of pleasure, being around like-minded people, being able to be your authentic, genuine self, and how that allows you to feel, we all can identify with that when we're around people who we can be ourselves with, we feel better. And so when people step away from the scene, quite often there's a sense of loss and there's a sense of grief, not just with this heightened sexual pleasure, which sometimes is really difficult then to replicate without those drugs. And the erections are really hard to get. And what tends to happen with some of these drugs is they delay ejaculation as well. So premature ejaculation can happen too. And that sense of, just elation that comes with particular drugs like G is very frustrating. But then also we've got that aspect of stepping away from a community where perhaps people felt connected and loved and appreciated and could be themselves.
We're social beings. We need that. And that's why if we can just get this out into the general community, so much more so, we will understand why someone can't be ostracized. You can't push people away because they're different from us. These people, everyone, we all need social connection, and we can't keep doing what we've been doing, essentially, because it's not helping everyone anyway. Okay,
absolutely. Sure. And I think thinking about the pleasure, maybe we can just bring in the pain as well. And loss, overdose happens quite regularly. I mean, I mentioned sexual assault does happen, and I mentioned HIV, which has happened, and I have heard and seen people having experienced what's called bug chasing. So sometimes people engage with an attempt to get an STI or contract HIV, for example. Now that's a very different aspect in and around the chemsex scenes and scenes in general. So I'm not going to necessarily talk about that, but ultimately what happens is that people come in, as I mentioned, that something has happened for them or to them. And that's really devastating. But alongside this is the drugs themselves. So I particularly always like to talk about G, because G is an interesting drug. So it comes in a clear liquid, so it's just like water.
Oh, wow.
And you have to measure it, thinking about your BMI, so your height, your weight, etc. So the amount that you can tolerate is different to somebody else. And it can be a millimeter off.
Sure.
And if you're a millimeter off, you can end up overdosing.
Sure.
but also if you've taken it at too short or too long a duration, no, too short a duration, it means you can hit into an overdose as well. So just to kind of think about harm reduction and safeguarding yourself if anybody's listening and engaging with G or using G, but also people who perhaps have friends or family members who they know use it, is just to be mindful of the ways in which you can overdose. So little things like putting food coloring in it so you don't mix it up with water. Or another thing is writing down the time in which you took it as well, your last dose. Putting a timer on your phone, being kind of savvy as much as possible. So taking drugs is always about looking after yourself, but particularly with something as volatile or as fragile as G, it's about just being very cautious of how you take it as well.
Yeah, absolutely. I mean, once again, if we don't speak about these things, how are people to know? And this is when we get those problematic cases. It's really interesting, especially because now this person's in a psychoactive state. For them to properly manage use, and like you say, it's not just a once-off thing. It's typically over the weekend, over a couple of days. So within that, someone would need to really be cautious as to how they use it, and they would need to know as much as possible about the drug if they plan on continuing use. Sure.
Yeah. And there's lots of resources out there that do talk about harm reduction, and that's paramount. As much as I may talk about the pleasurable aspects of chemsex and how we need to be mindful and be conscious that people are engaging with drug use to heighten their ability to enjoy sex and enjoy their experience, is harm reduction is still paramount. To ensure that you're safeguarding yourself, but also safeguarding a person that you may be with and using G with. And so it's just being very kind of conscious about that. But it's one of those things where even this, it's similar with regards to alcohol. We have a saying in Ireland, know the one that's one too many. So it's trying to be mindful of your capacity to, your ability and your tolerance level too.
Yeah, so definitely if you're a new person to this Chemsex community, really getting as much information as you possibly can prior, so that you go in mindful throughout. Sure.
Yeah.
Okay.
Yeah. And I think that's something that I speak about quite a bit. And so one of the things I would be really encouraging somebody is, if you are a friend and you of somebody who you feel is engaging with the chemsex scene, is judgment, being really cautious about how you might engage with them in having that conversation. And I would be suggesting as to ensuring that you have a sober conversation. Don't do it in the pub, and do it at home over a cup of tea or something, and a safe place, and say what you're noticing.
Yeah.
Say what you're noticing in that person. I'm noticing that you're not coming home over the course of the weekend, or I'm noticing that you're not making it into work on a Monday, and I'm noticing that perhaps you don't seem like you're very well in yourself. You seem quite low, you seem quite flat. I'm wondering, I'm curious what's happening for you. And I'm really listening to what might be coming up for them, and maybe they'll be honest, maybe they won't, but at least planting the seed that you're there. That you're there for them and you can support them.
I love that you've mentioned this specific point, is how family members, friends, etc. can communicate in a safe and non-judgmental way. Because like you said, the one of the reasons for use might be because of a history of trauma. We can't just go in judgmental as if we fully know and understand this individual, because there might be underlying factors that have led them to them. We can't judge those individuals. And then really giving people tools as to how to communicate. I'm noticing this, I'm noticing this. You're giving that person love and care and affection, which might be what they desperately need. Thank you for that. Thank you.
Yeah. Yeah, and I really feel that's coming from a place of curiosity rather than blame, or and really kind of encouraging them to open rather than um, being very directive about it, and open rather than closed questions, and maybe then you can make suggestions if they've said, I'm struggling. And I suppose this kind of fits broader than just the chemsex scene too, but maybe you can make suggestions. Okay, well, you're struggling with this.
Yeah.
How can I best support you? What do you need from me? And then maybe it's something like, well, is there a way we can find an avenue together? Is there something we could do together? Let's sit down, Google together what support systems are out there.
Yes.
And I'm happy to go with you for your first session,
Yes.
etc. So just being really supportive and caring.
Yeah, amazing. I think that this episode is going to go really, really well with another one that I've done, which is about trauma-informed care. So the person that is now addressing the individual of concern would need to make sure that they themselves are not triggered by this interaction.
Yes.
Because you need to check yourself. If you're going to go in initially with a loving attitude, but then you might hear something uncomfortable from that person for you, if you're going to then lash out, you need to make sure that you're prepared for that. It's trauma-informed care, really just going in, like you say, open-minded, prepared, ready to hear whatever, ready to receive, ready to love, ready to give, ready to take. So if you are wanting to have this conversation, you yourself might seek help from someone such as Aoife, so really just preparing. How can I best support this individual? And just making sure that you're prepared for this so that you can get good outcomes either way. Divine.
Absolutely. Yeah, absolutely. Being really present, open-minded, and also looking after yourself too is vital.
Yeah. So with this, Aoife, I mean, is there anything else that you kind of want to touch on before we end off? I mean, you've given us so much valuable information, the pain, the pleasure, the basics, the how to communicate with someone safely. Is there anything else that you wanting to share with us on the topic of chemsex?
I don't really think so. I think what I would really encourage people to be aware of is that kind of dual aspect to it, that sometimes there's a push and pull with, and just sitting with that discomfort of knowing that both are there. And we can't negate one without negating the other. And so I think my biggest pointers to this would probably be what I've just said around engaging with a friend, and what you have reiterated and pointed out around self-care as well. But how to look after people, being aware of some of those signs and symptoms of a struggle, or also maybe like depression or anxiety that sometimes go hand in hand with the problematic use. But that's it for me. I think it's just not brushing it under the rug. That's what I would say.
Yeah. Oh my gosh, yes. If you're going to take home something, that's one, is to really just handle this with care, like we would other health concerns. Sure. So Aoife, thank you so much. I am so incredibly grateful for how generous you have been with educating all of us, and with me and all of those who are listening here. It can be an uncomfortable topic for some, but it's a necessary topic to understand, because you never know who or what you yourself might engage with, and being informed is the best way that we can prepare ourselves for this. People say knowledge is power, but it's not. Knowledge is not just power. It's what you do with it. That's where the power comes in.
Yes.
You take that knowledge and you action it. So once you've got this, if you need to use it, you've got the tools now. They're yours to keep. So Aoife, please share with us, how can people further engage with you? Where can they find you? Someone might want to set up an appointment. Where can people reach you?
So my website is drurytherapy.com, and my Instagram is Drury Therapy, and then I went a little bit rogue and put Drury Sex Therapy into the Twitter, my Twitter handle, which I don't use Twitter very often, to be fair. So those are the three main avenues that you can contact me on.
Divine, and those will all be in the show notes if anyone is looking to engage and just get a fast link through to contact Aoife. So thank you so much. I appreciate your time. It's been a joy to share with you, and I really could ask about 101 more questions. So I might need to have you back here in the future.
Thank you for having me.
Yeah, absolute pleasure. Well, NurturePod listeners, until next time, please review and subscribe. And as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for 20% discount on all pelvic and sexual health courses. And now, let's indulge in a gift from Guided by Glow, whose mission it is to create a transformational practice of awakening your sensual feeling body, igniting your imagination, and cultivating a positive and thriving sexual relationship with yourself. Try today and take $20 off your annual membership using promo code NURTURE. Go to guidedbyglow.com or find it in the App Store.